14 powerful plants that strengthen bones and joints. Hello, herbalists. Did you know that there is a plant with more calcium than milk? That you have probably been pulling out of your garden for years, convinced that it was just a weed? And it's not the only one. Today we're going to look at 14 plants that modern science has validated for strengthening bones and joints. You probably already have some in your kitchen. Others grow on the sidewalk in front of your house. And the reason why nobody told you about them before has more to do with economics than with medicine. Stay until the end, because number 11 and number 12 together form a combination that clinical studies have compared in effectiveness to prescription anti-inflammatory drugs, without any of their side effects. There's something most people don't know about their bones. They aren't static structures. They aren't like the cement in a building that's built once, and that's it. Your bones are alive. Right now, as you hear this, your body is breaking down old bone cells and creating new ones in a continuous process called bone remodeling. And it continues throughout your entire life. The problem arises when this balance is disrupted. This is especially true for women after menopause, when the drop in estrogen causes breakdown to outweigh bone growth. That's when osteopenia appears. And then, if left untreated, osteoporosis develops. But here's what nobody tells you at the doctor's office. You can directly influence that process through what you eat and what you consume. And the plants I'm going to show you today act exactly at that point. On bone metabolism, on joint inflammation, on collagen synthesis, on calcium absorption. These are not old wives' tales. They are biochemical mechanisms measured in the laboratory and confirmed in clinical trials. A few months ago, I received a message from a follower named Carmen. She was 58 years old. She was writing to me from the doctor's waiting room, just after she had been diagnosed with osteopenia. She told me that her mother had died from complications of a hip fracture at 72. That the doctor had told her that if she didn't start medication, the risk of the same thing happening to her was very high, and that she was afraid, not of getting old, afraid of following the same path as her mother. I replied that same day. I asked him if he had heard of nettle, red clover, or horsetail. He said no, that it all sounded like folk remedies with no basis in reality. I sent him 3 clinical studies. He read them and decided to give it a try. I'm going to tell you what happened with Carmen at the end of the video. But first, let's talk about the 14 plants. Because what I showed her is exactly what I'm going to show you today. We're going to rank them from powerful to absolutely extraordinary. And I promise you that by the time we get to number 12, you'll understand why some women have partially reversed a diagnosis of osteoporosis without taking a single medication. Let's begin. Number 1. Stinging nettle, Urtica dioica. The weed with more calcium than milk. The first one is the one I mentioned in the hook. And I understand. When you hear stinging nettle, the first thing you think of is that plant that stings and leaves your skin burning if you touch it without gloves. Exactly that one. That's the one that has more calcium by dry weight than cow's milk. And that's just the beginning. Nettle contains calcium, magnesium, silicon, boron, and vitamin K. 5 essential nutrients for bone health in a single plant. But silicon is the one I'm most interested in explaining, because it's the mineral that's almost never talked about and yet turns out to be absolutely critical. Silicon doesn't build bone directly. What it does is help calcium integrate properly into the bone matrix. Without enough silicon, the calcium you consume won't reach where it needs to go. It's like having the perfect bricks to build a house, but no cement to bind them together. Scientific studies have shown that nettle can increase bone mineral density and reduce markers of bone resorption, the process by which the body breaks down bone tissue. Furthermore, it has potent anti-inflammatory properties with a specific effect on joint pain. Traditional herbalists classified it as a nutritive, not medicinal plant. What's the difference? Medicinal plants are used in short cycles to treat a specific ailment. Nutritive plants can be consumed daily indefinitely, because they simply nourish the body without adverse effects. Nettle belongs to this second category. How to use it? As an infusion, 1 or 2 cups a day of dried leaves. In soups and stews cooked, it completely loses its stinging properties. In green smoothies if you have fresh leaves, or in capsules if you prefer that option. The trick is cooking. As soon as you apply heat to the fresh leaves, the stinging hairs are deactivated and you can handle them without any problem. Number 2. Horsetail, Equisetum arvense, the queen of silicon. If nettle already has silicon, horsetail takes it to another level. This plant can contain up to 10% silicon by its dry weight. That's extraordinary. There's practically nothing else in the plant kingdom that comes close. And the silicon in horsetail has a very specific function. It's essential for collagen synthesis. Collagen is the protein that forms the matrix onto which calcium is deposited in bones. Without that collagen matrix, it doesn't matter how much calcium you consume. Your body can't build strong bone because it lacks the structure to anchor it. In a study conducted in Italy with postmenopausal women, those who took horsetail extract showed significant improvements in bone density after just 6 months. Researchers were surprised because the improvement was comparable to that achieved with some pharmaceutical drugs, but without any of the side effects. In addition, horsetail has mild diuretic properties with a behavior opposite to that of pharmaceutical diuretics. Instead of causing the body to lose minerals, it seems to help retain and make better use of them. Preparation: boil water, add dried horsetail, let it steep for 10 minutes, strain, and drink. 1 or 2 cups a day. It has a neutral, earthy flavor that most people find easy to drink, and it combines very well with nettle for a complete remineralizing infusion. Number 3. Parsley, Petroselinum crispum, the decorative herb that nobody eats. The third one is the one that most infuriates me because it's ignored. Because it's in every kitchen, in every market, and most people use it as a garnish and then leave it. Parsley is one of the richest natural sources of vitamin K. And vitamin K is absolutely critical for bone health in a way that very few people know. Vitamin K activates a protein called osteocalcin. Osteocalcin literally attracts calcium to the bones and anchors it in the bone matrix. Without enough vitamin K, you can take all the calcium in the world from supplements and dairy products, and a large portion of it won't end up in your bones. It will circulate in your blood and eventually be eliminated. The fact that always leaves people speechless. 2 tablespoons of fresh parsley contain more than 100% of the recommended daily intake of vitamin K. 2 tablespoons. The kind we usually throw away. A study of over 70,000 women over 10 years showed that those with the highest vitamin K intake were 30% less likely to suffer a hip fracture than those with the lowest intake. A 30% risk reduction, just from eating enough vitamin K. And parsley does more. It is rich in vitamin C, necessary for the formation of collagen, and contains flavonoids with anti-inflammatory properties. The most effective way to use it is raw and fresh, in salads, green smoothies, and juices. You can also use it in tea by boiling a handful in water for 5 minutes. But the most important thing is simply not to throw it away. Every time parsley garnishes a dish, eat it. Number 4. Dandelion, Taraxacum officinale, the weed worth its weight in gold. This 4th weed is the one most people angrily pull out of their gardens. The one they spend money on herbicides to eliminate. The one they consider the number 1 enemy of the perfect lawn. The dandelion. And every time you pick it, you're eliminating one of the most nutritious and medicinal plants in existence. It is rich in calcium, magnesium, potassium, and vitamins A, C, and K. But what makes it especially interesting for bone health is its boron content, a trace mineral that is almost never talked about and that has 2 crucial functions: preventing calcium loss through urine and participating in the synthesis of vitamin D. Calcium loss through urine is one of the most overlooked factors in bone loss. Boron acts as a brake, retaining calcium in the body instead of allowing it to escape. This is especially relevant for postmenopausal women, who already have an increased risk of bone loss. In communities where dandelion is regularly consumed as food, rates of osteoporosis are significantly lower. This has been documented in several regions of Europe and Asia. In Italy, there is a traditional salad made with young dandelion leaves, and when researchers cross-referenced dietary and bone health data, dandelion was the factor most strongly correlated with better bone density. And you can use everything: the young leaves in salads, with a sweet or acidic dressing that balances the bitterness; the roasted and ground roots as a coffee substitute, which also supports liver health. And the liver is important for bones because it's the organ that metabolizes vitamin D. The flowers for infused honey. The next time you see dandelions in your garden, don't pull them up, harvest them. Number 5. Alfalfa, Medicago sativa. The queen of forages that also takes care of us. The fifth one has a characteristic that makes it unique among all the plants on this list. Its roots can grow up to 9 meters deep in the soil. 9 meters. That means it accesses minerals no other plant can reach. Minerals in soil layers that conventional plants never touch. The result: alfalfa is exceptionally rich in calcium, magnesium, phosphorus, potassium, and virtually every trace mineral you need to build strong bone. It's also an excellent source of vitamin K and protein. But what makes alfalfa especially interesting for women is its content of isoflavones, plant compounds with a structure similar to estrogen. Before you have any doubts, let me explain why this is good news. During menopause, the drop in estrogen is one of the main causes of accelerated bone loss. The isoflavones in alfalfa can bind to the body's estrogen receptors and provide a very mild estrogenic effect that helps slow this loss, without the risks associated with synthetic hormone replacement therapy. Studies with postmenopausal women have shown that regular consumption of foods rich in isoflavones significantly reduces bone mineral density loss compared to those who do not consume them. Isoflavones also have anti-inflammatory and antioxidant properties that benefit the entire body. The easiest way to consume it is with alfalfa sprouts, which you can find in any supermarket or grow at home in a week. Enjoy them in salads, sandwiches, or smoothies. They are also available in capsules or powder. Warning: if you are taking blood thinners, consult your doctor first, as vitamin K can interfere with these medications. We have 5 herbalists: nettle, horsetail, parsley, dandelion, alfalfa. 5 plants that work primarily on a nutritional level, remineralizing, providing vitamin K, silicon, boron, isoflavones. Now we're shifting gears. The ones that follow act more powerfully on joint inflammation, cartilage protection, estrogen metabolism, and the synthesis of new bone tissue. The ones almost no one knows about. The ones herbalists keep to themselves. The ones science is rediscovering with surprise. Stay tuned, because the best is yet to come. Number 6. Red clover, Trifolium pratense, the protector of women's bones. Number 6 is especially important for women who are going through or have gone through menopause, and it has solid clinical evidence to back it up. Red clover contains 4 specific isoflavones that are particularly effective in protecting bone health: genistein, daidzein, bioquinin A, and formonitin. Each has unique properties, but genistein is the most studied. Genistein does 2 things simultaneously. It stimulates the formation of new bone and inhibits bone resorption. In other words, it activates the process of building bone while simultaneously slowing down the process of breaking it down. This dual mechanism is what makes it so potent. In a study conducted in Italy, postmenopausal women who took red clover extract for 12 months showed a significant increase in bone mineral density in their spine and hips. The placebo group, during the same period, experienced a loss of bone density. The researchers concluded that red clover has a protective effect on bones comparable to some pharmaceutical medications, with no reported side effects. In another study, women who consumed red clover reported significant reductions in hot flashes, night sweats, and joint pain. This is no coincidence. Red clover acts systemically on hormonal balance, not just on the bones. It can be consumed as a tea by steeping the dried flowers for 10 to 15 minutes. It has a mild, slightly sweet flavor that most women find pleasant. It is also available in capsules or as a liquid extract for a more concentrated dose. Number 7. Cilantro, Coriandrum sativum. The bone detoxifier. The seventh establishes a connection that conventional medicine rarely explains: the relationship between heavy metals and bone loss. Heavy metals like lead, mercury, and cadmium accumulate in bones and interfere with normal bone metabolism. Lead, in particular, is stored directly in bone tissue and can displace calcium, weakening the structure from within. And we live in a world with higher levels of exposure to heavy metals than at any other time in history. Air pollution, certain foods, old dental fillings. Cilantro has the unique ability to bind to heavy metals and help the body eliminate them. In biochemistry, this is called a chelating agent. Studies have shown that regular consumption of cilantro can significantly reduce heavy metal levels in the body, indirectly but very effectively protecting and even improving bone health. And there's more. It's rich in vitamin K, vitamin C for collagen synthesis, and contains antioxidant compounds that protect bone cells from oxidative damage. The most effective way to enjoy it is fresh and raw, in salads, smoothies, juices, and sauces. If you're one of those people who perceive cilantro as tasting like soap, I have good news. That's genetic, completely normal, and there's nothing wrong with you. Simply use another herb from this list. But if you like cilantro, make the most of it. You'll be hard-pressed to find another food that does what it does. Number 8. Comfrey, Symphytum officinale. The knit bone of the battlefields. The eighth has one of the most descriptive names in all of herbalism. Its English name is knit bone, and its Latin name comes from the Greek symphio, which means to unite. For centuries, comfrey was the first-line remedy for fractures, sprains, and serious joint injuries. It was used both internally and in external poultices. Today, as a precaution, it is recommended for external use only, and I'll explain why in a moment. The active ingredient that makes it so effective is allantoin, a compound that directly stimulates cell regeneration and the formation of new tissue. Allantoin accelerates the healing process by promoting cell proliferation and collagen synthesis. It also contains mucilage with anti-inflammatory and soothing properties, and is rich in calcium and other minerals. When applied externally to an injured area, comfrey penetrates deeply into the tissues and measurably accelerates healing. Modern clinical trials have confirmed significant reductions in pain and functional improvements in sprains, acute lower back pain, and osteoarthritis when applied topically as an extract. The warning I promised: comfrey contains pyrrolizidine alkaloids that can damage the liver if ingested in significant quantities over prolonged periods. Therefore, for external use only, never on open wounds. Never ingest regularly as an infusion. How to use it? Look for comfrey creams or ointments in natural product stores, which are the most practical and controlled option. If you have access to the fresh plant, you can make poultices. Wash the leaves well, crush them into a paste, and apply it to the affected area covered with gauze. Change the poultice 2 or 3 times a day. Number 9. Sage, Salvia officinalis. Bones and hormones in balance. You already know about sage from the video on memory and concentration, where we saw how it inhibits the degradation of acetylcholine and improves cognitive function. But it has a second side that fits perfectly in this video. It is one of the best allies for bone health in women during menopause. It contains vitamin K, calcium, and compounds with mild estrogenic effects that may help partially compensate for the drop in estrogen during menopause. And remember what we said before. Estrogen regulates bone metabolism, and when it drops, bones begin to lose density more rapidly. In addition, the rosmarinic acid and carnosol it contains are powerful anti-inflammatories that act on the joints. Chronic inflammation degrades articular cartilage. Reducing it is not just about relieving pain, it's about protecting the joint in the long term. And its antioxidants protect bone cells from oxidative damage, which is another factor that accelerates bone loss over time. Sage also has specific properties to reduce hot flashes and night sweats. This means that by improving sleep quality, bone recovery and regeneration that occurs during rest are also indirectly improved. Drink sage tea once or twice a day, using fresh or dried leaves. Or use it as a spice in cooking, on chicken, pasta, roasted vegetables. You can also make sage honey. Caution: if you have epilepsy or any seizure disorder, avoid concentrated extracts and consult your doctor. Number 10. Rosemary, Rosmarinus officinalis. The guardian of bone tissue. We also saw rosemary in the memory video, where we learned that its aroma can improve long-term memory by 65%. Here's its other side. It's an extraordinary guardian of bone tissue. It contains carnosic acid and carnosol, two compounds with specific protective effects on bone cells. Studies have shown that rosemary can inhibit the activity of osteoclasts, which are the cells responsible for breaking down bone tissue. By slowing down that activity, it helps preserve bone density. Its antioxidant capacity even surpasses that of vitamin E in some studies. That means it protects cells throughout the body, including bone cells, from damage by free radicals. In addition, it improves blood circulation, and this matters for bones more than it seems. Bones need a constant supply of blood to receive nutrients and remove metabolic waste. Poor circulation is one of the silent causes of bone deterioration. For joints specifically, its anti-inflammatory properties can significantly reduce stiffness and pain with regular use. How to incorporate it? Rosemary tea every morning, with fresh or dried sprigs. Rosemary oil for massages on sore areas, which you can make by infusing dried twigs in olive oil for 4 weeks. And of course, fresh in the kitchen: meats, fish, roasted vegetables, breads. Number 11. Ginger, Zingiber officinal. The anti-inflammatory that rivals medicines. The 11th is where the scientific evidence starts to get especially serious. Ginger contains bioactive compounds called gingerols and shogales with anti-inflammatory properties that have been shown in studies to be comparable in effectiveness to some non-steroidal anti-inflammatory drugs, but without the gastrointestinal side effects that those drugs cause. That's not my opinion. It's what peer-reviewed scientific literature says. How does it work? Ginger inhibits the production of prostaglandins and leukotrienes, the substances responsible for much of the pain and joint swelling when there is inflammation. By reducing the production of these substances naturally, you can relieve joint pain and significantly improve mobility. In addition, it improves blood circulation to the joints, facilitating the delivery of nutrients and the removal of waste products that contribute to pain and stiffness. In people with osteoarthritis, several studies have shown pain reductions equivalent to those of ibuprofen after several weeks of regular use. Think about what that means for a woman who has been taking anti-inflammatories for years with her stomach suffering every time she does. How to use it? Freshly grated ginger in an infusion is the most potent way. Grate a tablespoon into hot water. Let it steep for 15 minutes, strain it, and drink. You can add honey and lemon to enhance the flavor. Use it in smoothies, soups, or everyday cooking. Also in poultices on sore joints. Fresh grated ginger wrapped in gauze and applied warm. Important warning: ginger has natural blood-thinning properties. If you are taking blood-thinning medication or are going to have surgery, consult your doctor. For the rest, in normal food-grade quantities, it is completely safe. Number 12. Turmeric, Curcuma longa. The one that can protect cartilage that should no longer return. And here's the combination I promised at the beginning: ginger plus turmeric. Together, the two form one of the most powerful anti-inflammatory duos that nature provides. Turmeric contains curcumin, one of the most studied natural compounds in global pharmacology. And for joint health, what it does is revolutionary. First, it reduces pain and improves function in people with osteoarthritis in a way comparable to anti-inflammatory drugs. That is documented in controlled clinical trials. Second, and this is the game changer, curcumin can protect articular cartilage from degradation. Cartilage is the tissue that covers the ends of bones and allows joints to move without friction. In osteoarthritis, that cartilage degrades, and when it's gone, it's gone. It doesn't come back. But curcumin inhibits the enzymes that destroy cartilage and stimulates the cells that produce new cartilage. It doesn't just relieve the symptom. It potentially slows down or even partially reverses the underlying joint damage. In a clinical trial conducted in Italy, patients with knee osteoarthritis were divided into two groups, one with standard anti-inflammatory treatment and the other with a highly absorbable curcumin supplement. After 3 months, both groups showed similar improvements in pain and function. But the curcumin group reported significantly fewer side effects, better quality of life, and blood tests with lower levels of inflammatory markers throughout the body. The historical problem with turmeric has been absorption. Curcumin alone is very poorly absorbed in the intestine. Here are 2 essential tricks to maximize its effectiveness. First, always combine it with black pepper. The piperine in black pepper increases the absorption of curcumin by up to 2,000%. It's not optional, it's essential. Second, take it with healthy fat, because curcumin is fat-soluble. A smoothie with turmeric, black pepper, and a tablespoon of coconut or avocado oil is the perfect combination. Powdered in the kitchen, curries, soups, rice dishes, scrambled eggs, the famous golden milk with turmeric, plant-based milk, honey, and spices. For supplements, look for formulations that guarantee improved bioavailability, with piperine or phospholipids. Warning: may interact with anticoagulants and diabetes medications. If you are taking medication, always consult first. Number 13. Garlic, Allium sativum. The one that takes care of the bones from the inside out. Garlic for bones. I know it may sound surprising, but the mechanism by which it works is straightforward and well documented. Garlic contains sulfur compounds, especially allicin, with powerful anti-inflammatory and antioxidant properties. But what makes it especially relevant for women's bone health is another mechanism. Studies have shown that it can slightly increase estrogen levels in postmenopausal women. And we already know what that means for bones. Estrogen regulates bone metabolism. When it rises, even slightly, it slows bone loss. In a study with postmenopausal women, those who consumed garlic regularly showed less loss of bone mineral density than those who did not consume it. In another animal study, garlic was shown to prevent estrogen deficiency-induced bone loss in a manner comparable to some medications. The researchers identified 3 mechanisms: increased estrogen, reduced inflammation, and improved absorption of certain minerals. The trick to maximizing its benefits: after crushing or chopping the garlic, let it rest for 10 minutes before cooking or consuming it. During those 10 minutes, the enzymes convert alliin into allicin, which is the compound with the most potent medicinal properties. If you cook the garlic immediately, you destroy those enzymes before they can complete their job. If you wait 10 minutes, the allicin will have already formed and will better withstand the heat. Raw garlic is the most potent. If you can't tolerate the taste, fermented garlic honey is a delicious alternative. Peel several cloves of garlic, place them in a jar, cover them with raw honey, and let it ferment for several weeks. The result is a mild and sweet garlic, much easier to consume. Number 14. Celery, Apium graveolens. The vegetable that looks like water but isn't. And we've reached the last one. Number 14. Celery. The vegetable that almost everyone underestimates because it seems to be basically flavored water. That prejudice does a disservice to a plant with genuinely impressive properties. Celery is rich in silicon, the third food on this list after nettle and horsetail, that provides us with this mineral so critical for collagen synthesis and the integration of calcium into bones. But what makes celery unique are two specific anti-inflammatory compounds, apigenin and luteolin, which turn out to be especially effective at reducing joint inflammation. They are not generic anti-inflammatories. They act primarily on joint tissue. A study with people with osteoarthritis who took celery seed extract reported significant reductions in pain and improvements in mobility after only 3 weeks. The seeds are more potent than the stems because they have higher concentrations of active compounds, but fresh stem juice is also very effective. In addition, celery contains phthalides, compounds that relax the smooth muscles of blood vessels and improve circulation. Better circulation to the joints means more nutrients arriving and more waste products being eliminated. And it has alkalizing properties. An overly acidic body draws calcium from the bones to neutralize that acidity. Celery helps maintain balance. The most effective way: fresh celery juice on an empty stomach, half a liter in the morning. If the flavor is too strong, add an apple or a little ginger. Also raw in salads, in soups, in stews. The powdered seeds can be added to infusions or taken in capsules. Simple, accessible, and with more science behind it than anyone would expect from this often overlooked vegetable. Do you remember Carmen, the woman who wrote to me from the doctor's waiting room with a diagnosis of osteopenia and the fear of following in her mother's footsteps? I recommended she start with 3 simple and accessible plants: nettle and horsetail infusion in the mornings, red clover as a supplement, and turmeric with black pepper in her daily smoothie. Resistance training 3 times a week. And patience. A year later, he sent me the results of his bone density scan. The osteopenia had not progressed. In fact, there was a small but measurable improvement in her lumbar spine. Her doctor, who had been skeptical from the start, asked her what medication she was taking. When he told him that he hadn't changed anything, that he had only changed what he ate and added some plants, the doctor asked him to write it all down. That doesn't mean that plants are the solution for all cases. If you have been diagnosed with osteoporosis, if you have had fractures, if you have severe joint pain, you need to be under the care of a health professional. These plants can be allies to conventional treatment. They are not always a substitute. But for many women, what Carmen did is possible, and no one had told them it was possible. One practical recommendation before I say goodbye: don't try to incorporate all 14 at once. Choose 2 or 3 that resonate with you, that are available, that fit into your routine, and be consistent. Consistency is worth more than quantity. It is better to use 2 plants every day than to try to take 14, and not take any because the system becomes too complicated. Start simple, perhaps with an infusion of nettle and horsetail in the mornings. Perhaps it's because you added real parsley to your salad. Perhaps it's because of the turmeric and black pepper smoothie. Small steps. Every day. For months. This is how it works. There are no shortcuts, but the results are real. If this video has opened your eyes, if you've learned something you can apply to your life, give it a like and share it with that woman in your life who is struggling with joint pain or is worried about her bones. Your mother, your sister, your best friend. What we have seen today is too valuable to keep to ourselves. Tell me in the comments, which of these 14 plants surprised you the most? Which ones did you already know?